Katie.
Hi.
Welcome back. My name is Dr. Matt. I'm going to do your exam.
Okay.
So, let's see. I have here your file. Can you please verify your date of birth?
Sure, it's March 23rd, 1989.
Perfect. So go ahead and tell me what's going on.
I've been having some stomach pain lately, just like a lot of tenderness and soreness, especially near the belly button, kind of in the middle area.
Okay.
I don't know what it is. Sometimes it gets a little red too, like it isn't today, but a few days ago it turned red for a few hours. And also I'm having back pain, just like in my midsection of the back, kind of on either side of the spine. Just a lot of tension, and I don't know if that's related or not, so that's why I'm here.
Okay. I can definitely take a look and see exactly what's going on and try to find the cause of it.
Okay.
Okay. How would you rate your back pain on a scale of 0 to 10?
I would say it's about 6 or 7.
It's pretty intense. Have you been
Yeah.
taking any pain medicine?
Ibuprofen.
And for the stomach pain, you said it's around the belly button.
Yes.
Have you been taking any medicine?
No, not for that. I'm just not sure what I would take. It's just like a soreness that won't go away.
And is this the first time that you were being seen for this issue?
Yes. Yeah.
Okay. Are you taking any medicine on a daily basis?
Yes, I'm weaning off of Wellbutrin, so I'm taking only like 25 milligrams a day, which is a really low dose, and trazodone at night to sleep.
Okay. Just in case we need to prescribe any medication to make sure that it doesn't interact with what you're already taking. Yeah. Perfect. Okay. Okay, I'm just going to go ahead and put gloves on. And how would you describe your abdominal pain? Is it sharp or dull?
It's dull, yeah.
On a scale of 0 to 10, how would you rate it?
It would be about an 8 if you press on it, yeah.
Okay, I'm going to put this on your index finger. Go ahead and relax. And we'll wrap this around your upper arm. Okay, I'm going to have you uncross your legs. This is going to feel a little bit cold. Blood pressure is a little bit elevated, so we're going to make sure that we have that in your medical records. Heart rate looked normal and oxygenation is good.
Okay.
So I'm going to keep an eye on it. We want to make sure that if it is an infection, we treat it properly with a broad spectrum antibiotics.
Okay.
But first, I'm going to need to take a look and see exactly what we're dealing with to see if there is any fluid that we could test.
Ooh, okay.
Okay. Blood pressure was 135/60. Systolic a little bit elevated. Heart rate was 70 normal. And then oxygenation was 95% on our meter. That's also normal. Alright, let's go ahead and take your temperature. Alright, this will go on your forehead, so go ahead and relax. 96.6. That's a very good sign.
Okay.
Did you take any ibuprofen before coming in?
I did, yeah.
You did?
Yeah.
Okay. Then the ibuprofen might mask any temperature spike if you are having any. Did you experience any flu-like symptoms?
No, I haven't. I haven't felt feverish or chills, nothing like that.
Okay. I'm going to have you lay down and I'll take a look at your stomach to see and your abdomen to see if there is anything concerning, okay?
Sure.
All right. Okay, Katie, is it okay if I lift the shirt up a little bit?
Yeah, go ahead.
And do you mind if I unbutton the pants tiny?
Not at all. Go ahead.
Okay. Let me go ahead and take a light here. I'm definitely noticing a little bit of redness around it. Some swelling. So how long ago did you notice the redness around the belly button?
That happened like 3 days ago. Yeah.
I'm going to listen with the stethoscope. This is going to feel a little bit cold. I would say definitely diminished sounds, especially in the center of the abdomen. And before I palpate, I'm just going to go ahead and take a sample.
Okay.
So what we're going to do is I'm going to sample and culture it to see exactly what kind of bacteria we're dealing with. And also I'm going to check for any fungal infection. going to take a few measurements here. We're looking for inflammation. We want to make sure that all 4 quadrants are symmetric. Going to feel kind of like a pinching sensation. We're looking for hydration status. Okay. So now I'm going to go ahead and check your back. Okay, Goody, I'm going to go ahead and put your hair up so that we can take a look at your back. Okay, before I start palpating, I'm just going to go ahead and listen. This is going to feel a little bit cold. Okay, everything sounds good. I'm going to go ahead and percuss. Going to palpate. We're looking for any swelling. Checking for spine misalignment. I'm not sensing any signs of scoliosis. We're looking at shoulder alignment. Just a deeper palpation here. We're checking for deep infection. Let me know if you feel any kind of pain as I'm palpating. I'm going to take some measurements. This is going to feel a little bit cold. there's definitely some inflammation at the base of the lungs. Although it does look like it's muscular, I don't think it's originating from the belly button. So they might be just two different issues. I'm going to touch you on left or right of your back. Go ahead and tell me if you feel this on the left or right.
Right. Right. Left. 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 Right. 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 Left. Right.
And now I'm going to touch you with a different texture. Go ahead and tell me if you feel this warm or cold.
Cold. Warm. Warm. Cold. Warm. Cold. 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 Warm. 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 Cold. Cold. Warm. Cold.
And now I'm going to touch you with a warm and a dull object. I'm going to need you to tell me if you feel this warm or dull.
Dull. Warm. Warm. Dull. Dull. Dull.
And I'm going to introduce cold as well at some point. So go ahead and tell me if you feel this cold, warm, or dull sensation.
Sure. Dull. Cold. Warm. Dull. Cold. Dull. Dull. Warm. Dull. Cold. Warm. Dull. Dull. Cold. Dull. Cold.
And now I'm going to introduce a fourth object, which is going to feel kind of like a sharp sensation. This is what it's going to feel like. So go ahead and tell me if you feel this cold, warm, sharp, or dull.
Okay. Dull. Cold. Sharp. Warm. Warm. Sharp. Dull. Sharp.
there's definitely a sensory problem. What we could do is to take a sample of the skin here as well and to see if it matches the same bacteria or, flora that's growing on the abdomen. Okay, I'm going to just take one more sample here. And we're going to send this to the lab.
Okay.
Okay, this is going to feel warm. And first I'm going to start with a sensory brush. It's going to help to reduce inflammation. You use cupping therapy. This is going to help to stimulate blood flow. I'm going to apply some acupressure therapy around the paraspinal muscles. This will help decrease inflammation in the area and activate the lymphatic drainage. also going to use a gua sha to help release the toxins from the soft tissue. Okay, I'm going to have you get dressed and we're going to talk about what other tests we should do, okay? Okay. Alright, Katie, I'm just going to go ahead and remove my gloves. And I would like to order an MRI for you.
Okay.
Alright, so we're going to do an MRI of the abdomen and back just to double check for any infection and to see if we need to order any antibiotics, okay?
Okay, alright. Sounds good.
And are you allergic to anything?
Not that I'm aware of, no.
Okay, so we're going to do an MRI. And if we can't find the source through the MRI, then maybe we're going to go with a CT scan with contrast.
Okay.
As soon as I have the blood culture ready, I will send you an email and we're going to start a course of antibiotics. I just don't want to start it right away. I want to make sure that we are targeting the right bacteria.
Infection. Okay. All right.
Do you have any questions for me?
No, not at this time, but you've been really helpful, so thank you.
You're welcome.
Yeah.
I'll see you soon.
All right, bye.